Hi everyone, Assalamualaikum. How are you guys doing? Hope you all are having an amazing day today. So, from the title down below, you can see the word microeconomics. So, what do you guys think we are going to talk about today? Let's check it out. But first, let me introduce myself and all the presenters of this group. It's me, Saida Maria Susan, with the matrix number 2021390. And the other presenters are Humaira Iddina Binti Muhammad Hidir, 2113954. Aida Safia Binti Muhammad Ghazi, 2110366. Ilyana Nazwa Binti Abdul Rashid, 2112740. Muhammad Ikmal bin Noor Hisham, 2111165. So, welcome to our macroeconomics presentation, and we are going to talk about demand and supply. Basically, the inconsistency in demand and supply of face masks during the COVID-19 outbreak. Before going to the details, we need to know what is demand and what is supply. Demand. Demand is an economic principle referring to the quantity of a good or service that consumers are willing to purchase at various prices during a given period of time. Supply. Supply pertains to how much producers of a product or service are willing to produce and can provide to the market with limited amount of resource available. Let's go to the next slide with the next presenters.
Thank you, Susan. Assalamualaikum. My name is Aida Safia binti Muhammad Ghazi, and my chip number is 2110366. I'm going to explain why demand in face masks increased due to COVID-19. As we know, COVID-19 or coronaviruses are a large family of viruses that cause illness ranging from the common cold to more severe diseases. The first COVID-19 cases were reported in Malaysia on 25th January 2019. Due to the COVID-19, the government mandates everyone to comply with standard operating procedures or SOPs such as wearing a face mask, perform a minimal physical distancing of 1 meter and more. Because of that, face masks, face shield and other personal protective equipments increased dramatically. In addition, a few months ago, Director General of Health Malaysia, Tan Sri Dr. Noor Hisham Abdullah suggested everyone to wear two face masks, as several variants of the new coronavirus have emerged throughout the world. So what is the advantage of double masking? It is better fit because there are many types of masks that don't fit perfectly on our face. In fact, we probably notice that we feel air escaping through the sides of our mask when we breathe in and out. The imperfect seal cannot only allow respiratory droplets containing the virus to escape our mask, but it can also allow them in. Double masking can help to better prevent this from happening. As a result, demand surged as more Malaysians opt for extra protection against COVID-19. That's all from me. Thank you.
So next, I'm Muhammad Ikmal bin Noor Hisham, and I will explain to you about example of manufacturing company that produce their goods in Malaysia. Firstly, Durio. What is Durio? Durio is a milk-blown fabric and mask manufacturer in Malaysia. They are one of the company that produce their goods in Malaysia. Firstly, they also plan to produce 240 million pieces of face masks monthly in order to support the current society demand for face masks on a reasonable price. As we know, currently we are facing pandemic outbreak and we need to take care ourselves by wearing face masks. And currently they also are working together with a premier global company in order to produce high quality face masks.
My name is Eliana Najwa binti Abdul Rashid. So, what is conflict crisis in demand of face masks due to COVID-19 outbreak? China was the main producer of masks at the start of the crisis, accounting for approximately half of world production. But even this was insufficient to meet its own demand related to COVID-19, and China imported a large quantity of masks. In January 2020, China could produce 20 million masks per day, which was insufficient to meet a total demand estimated at 240 million masks per day to equip health, manufacturing, and transport workers. Providing face masks to healthcare workers and COVID-19 patients all over the world already brings global demand to a level above pre-crisis production capacity. There are about 43 million healthcare workers in the world. Masks are generally assumed to be effective for about 4 hours and need to be regularly changed, assuming that only around one-third of healthcare workers need a mask, accounting for the fact that not all countries are affected at the same time and not all health workers are in contact with COVID-19 patients, and that each health worker uses on average 2 masks per day. Global demand for surgical masks will be around 28 million per day. Adding in caregivers and suspected COVID-19 patients further increases this demand, possibly by another 12 million per day, as masks are now recommended for a broader use by the general population, and an increasing number of countries require citizens to wear them in public places. The estimates provided above for China are likely to be applicable to other countries, leading to a demand for masks possibly 10 times higher than before the crisis in countries affected by the virus. To meet this demand, it is important to continue to increase supply. While China has considerably increased its production, other producing economies record more modest increases. Other solutions may be needed in the short term, such as the use of the alternative masks, such as use the lower grade mask or fabric mask for the general population. Let's move on to conflict in Malaysia. The Ministry of Domestic Trade and Consumer Affairs (KPD and HEP) found that the total demand for face masks in the market currently reached 15 million a month compared to 5 million previously. Before the COVID-19 pandemic, most of the local production face masks was for export, but actually more for industrial and manufacturing use, not for regular use. The effect of panic buying by the Malaysian population at the beginning of the pandemic, face masks and disinfectant liquid are items that are in high demand. This has forced suppliers to also increase the supply of their product, face masks, to meet consumer demand. Consumers buying face masks in large quantity has also led sellers to sell face masks at high prices.
My metric number is 2113954. In this slide, I will talk about government strategies. The first government strategies is government decision to put a cap on the pricing of the face mask. The ceiling price for the 3-ply face mask will be reduced from 1 ringgit per piece to 70 cents. Also, wholesale selling price will be reduced from 95 cents to 65 cents. Other than that, retail selling price for single layer face mask was set at 7 cents a piece, while 2-layer face mask was at 20 cents per piece, and N95 face mask at 6 ringgit per piece. These strategies is to encourage citizens to adopt for new norms. The second government strategies is Ministry has gazetted a ban on export of face mask product under the Control of Supplies Prohibition of Export Regulation Amendment 2020. These strategies is to ensure adequate supply of these face masks in the market to meet need in the country. Next is a conclusion that we conclude that Ministry of Domestic Trade and Consumer Affairs assure that it will always find the best balance approach for the benefit of various parties to ensure that the price of face masks can be controlled and the product is always available. Also, other firms like Durio, they also putting quality assurance as their top priority. Durio has invested in particle filtration efficiency testers to ensure a reliable filtration efficiency reading. That's all from us. Thank you.